Yep. And you're good to go.
Okay, good afternoon, everyone. As chairperson of the Jefferson County Health Department Board of Trustees, I want to call the regular February 2023 monthly meeting to order. So we'll have a roll call first, please.
I'm doing Jennifer's job today, so I apologize. So Dennis Steele,
Here.
James Prater,
Here.
Tim Pigg,
Here.
Amber Henry, and Susie Davis. Here.
Okay, so we have 4 of our 5 board members here, so we do have a quorum. And we normally read our mission and vision. Dr. Henry usually does that, but since she's not here today, I will. The mission of Jefferson County Health Department is to champion positive health outcomes and behaviors through innovative programs and community engagement. And the vision is advancing the health and safety of Jefferson County. So the next item is approval of the agenda. Everyone got a proposed agenda in their email. Can I have a motion to approve the agenda, please?
I'd like to make a motion to amend the agenda. I'd like to include the termination of lease agreement for the High Ridge office in the Jefferson County Library System.
I'll second that.
Okay, and that'll be under old business.
Yeah, we have discussed that, so.
Okay. Any other amendments, discussion on that? Okay, so we'll have a item under old business to discuss the.
Are we, point of order? Are we going to second that and vote on it? There was a second.
There has been a second.
Well, let's
I
have
asked
a
for
roll
this,
call.
do you have discussion?
Just that we need to roll call it and move
Oh,
to,
It's not a roll call.
We can vote on this, we can vote on the motion. So no one else has any discussion? Okay, so all in favor of the ocean as presented by James, please say aye.
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 I would be no, and we're still gonna get to discuss that later, right? That's
Yeah, it's just adding it to the agenda so we can discuss it.
Right.
You should have a copy of it in your
Okay, so
paperwork.
that motion passes 3-1. Okay, we have some visitors today.
We need to approve the agenda now, sir, don't we?
Motion to approve the agenda is amended.
Second,
We just did that.
No, you
approved
amended
the-
it, you haven't approved the amended.
All right, sorry about that. Okay, so motion second to approve the amended agenda. All in favor, please say aye.
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 I,
Could you introduce yourself, sir?
Alan Leaderbrand.
New man?
I'm Teresa with the Leader newspapers.
I'm sorry.
Teresa and Sarah with the Leader newspapers.
Ah, okay, so you're new, our new recorder.
Yes.
Welcome. It's nice to meet you. Okay, so our next items are approval of minutes and expenditures. First item is approval of the January 26th, 2023 meeting minutes. James and Tim were not in attendance at that meeting,
This has to be pushed off till next one. You don't have a quorum of people who are present.
so I have to table that.
Yeah,
Not here.
two people that are here were not there at the time.
Okay. So we'll table that for next time. Next items is approval of the January 2023 expenditures. Amount I have for those is $275,163.60. Can I have a motion to approve those?
Motion to approve.
Second,
Okay, so a motion second to approve those. Any discussion on those?
Mr. Chairman,
Yes, ma'am.
noticing, for our legal fees, again, extremely high this month. They were only like 1,600 last month, but I noticed that, Ms. Coleman has submitted, some more bills, and so, it probably went from like it did from 1026, 1130, all the way down to 118. She submitted another $18,251 in legal bills. In addition to that, she submitted, another, according to this, on the 9th of, January, submitted another, let's see, 1,500, 2,500, 1,100, anyway, added up all of those to $4,279 in legal fees. I just flabbergasted at, how our legal fees can be so extremely high with other boards that are doing similar things that we do, why we continue to allow this. I mean, I literally was sworn in here, and I swore to do what I could do to help this health board be financially frugal with its money and to represent the people that elected me. And I know you guys have the same certificate. What are we doing as a board to get these legal fees down? I'm
Mr.
asking
Chairman, may I
my fellow
clarify
board
what
members.
some
I'm not
of the
asking Kelly Vollmer at this point.
Ms. Davis,
I'm
I'm
asking
giving
my
an
board
explanation
members
of something that
that-
you've asked for
Ms.
information.
Davis, you're
I'm
asked,
asking my board members, we're in a discussion, what we are doing as a board to encourage Kelly Vollmer not to go to the attorney so often with things, and to try to run this like we've always ran it before these extremely high bills. Before
Mr. Deal, just a point of clarification, it actually represents 3 months worth of legal services that you've got in there.
Well, it's interesting that you say that, Ms. Coleman,
4
but
months.
honestly, 3 months, okay, in October you
I'm
charged
sorry,
us
it's
16.
4. It's 4 months worth.
Okay, well, in October, you also charged us 16,000. November, you also charged us 6,800. In December, you also charged us $7,500 legal fees. In addition to that, now you're charging us 18,000 and 4,000.
So-
This is just unacceptable. I'm sorry.
Just so you're aware, there are different matters that come in, so there's different file numbers basically that come in depending on what type of work is being done. And some of those are ready to go by the time that the bills go out, and some of them are not. So just because you may see a bill for $5,000 one month, it might be 2 matters worth, but there's actually 10 matters that I'm working on, and those other 8 were not ready to go. So that's why those folks might get bumped over for next month.
Okay, so if we have 18,000,
Miss
18, 19, 20,
Davis, could you-
$22,000.
Ms. Davis, could you allow us to discuss this other than just continuing to quote numbers? You explained, I don't know if it was at the last meeting or the meeting before, I thought very well detailed. And I don't know if you want to do that again or not. We have the same questions about the same things. We've explained those things. We've answered those things.
So
If people continue to ask the same questions after they've been answered, I have to wonder why. So do you want to explain that again or
No,
leave that on the record?
this discussion is.
You're out of order. Davis, I'm gonna ask
I'm
whoever
asking-
can answer a question.
I'm asking
I'm
my
gonna-
fellow board member
Do
to.
you want to do
answer-
that or not?
So a couple of things that were said last month that I did look into is that Ms. Davis said that for example, the county council spends less money on the legal fee. That is simply not true. The county council has county counselors that are on staff full time.
That has nothing to do with this.
You keep
That's-
comparing.
Absolutely.
what-
You're saying it's
Would you-
extremely high.
Ms. Davis.
It doesn't-
You have nothing to compare it to,
Okay.
Ms. Davis.
Ms.
Let her explain what she does.
In this discussion,
Go ahead.
that has nothing to do with anything. And that, in fact, I
What do
take
you mean
that.
it has nothing to
Does
do
have
with
It's
it?
something. I take that as,
Well,
I-
good
So
for you.
but it
you're
was.
bringing up something from that instead of addressing what I'm actually saying, which is.
I think that it is insulting to the public whenever you tell them that they're not true. So you told the public.
That has nothing to do.
Ms. Davis, you don't have the floor. Let her answer what I
She's
requested.
insulting me. That's not acceptable.
She's not insulting
Yes, she is.
you.
She's saying, oh, well, Susie said this, about the council.
She's not
That has
saying-
nothing to do
you
with
did-
how.
So,
Go ahead.
okay, so
Please.
I think that it's important that that the public that heard those kind of statements last month understand that the county council has full-time county counselors on staff. That they pay several hundreds of thousands of dollars a year to plus benefits. That's not the arrangement that we have here. I'm not full-time on staff like that. So to get that out there as point of clarification, and it was something that was made in the show, I think it did need to be addressed. So the rates, the way this is set up is that a lot of times, as we know, in the last 3 years, we've been defendants in lawsuits. And we've
And we
had,
are not now.
Ms. Davis. Thank you. Been defendants in lawsuits, and we've also been involved in other lawsuits that we had to intervene in because our attorney general at the time was not adequately representing the public interest. So we intervened in those until it got to the point where somebody else was ready to take the ball and run with it. And then that's what we backed out of those cases. We've had human resource training that needed to happen that hadn't been done for quite some time with our staff. We're required to do under state and federal law. So we updated our handbooks and we presented all the training to the staff that were required to provide. We have also taken on the Aspen project that we've received grant funding for. So the fees that you see associated with Aspen are not paid for by the residents of Jefferson County. It's paid by grant funding, and it's done on a flat fee basis that was negotiated at different stages of that project. So those bills are things that you see separate on their own line item as well, whenever you see the Aspen project on the bills. The board governance line items that you'll see are predominantly for my attendance at the meeting. I help review the minutes and make sure they are sunshine law compliant. I help review the responses that the staff prepares and drafts for sunshine law requests. Those responses make sure that we're providing all the information that we're supposed to be providing, that we are exercising the appropriate exemptions, or we're not giving documents in response to the request, make sure they're legally compliant. I attend the meetings, physically attend the meeting. And I also help prepare the agenda to make sure that it is sunshine compliant. There are other things that we deal with as far as trying to make sure that, if there's updates to the changes in the laws, I'm communicating those with the chair and with the director, make sure that we are doing what we're supposed to be doing to be legally compliant.
So, Mr. Chairman,
There's your answer. If you're
that's
not
not what I
happy,
asked.
if you're not happy,
asked.
that's your opinion.
Why my fellow board members are allowing these, shouldn't we put some kind of a, like, if these bills are gonna be at a certain amount, come back to us and let's talk about it, because we need to do something to get these down. It's almost,
Actually, Mr. Deal, the board did do that with the Robinson case. There was a cap on the legal fees in that case. And once we were close to approaching that, I did reach out to the litigation committee and say, here's what's left to do. We have this much left in the budget. I don't want to go over budget. And then we withdrew.
okay, so since this is a discussion,
We can't control who sends us a sunshine request. We can't control who sues us. There's no way we can do that, Ms. Davis. And so, again, I don't think you have any frame of reference as far, you're just looking at a number and saying.
you're personally attacking me.
I'm not
You're
personally.
what did you just say? What did you say?
You-
I know what?
You don't have the frame of reference.
Excuse me?
to
That's a
say-
personal attack on me.
No, it's not.
And I'm getting tired of your harassments.
I'm not harassing you.
Okay,
ma'am.
so let's keep it without personal attacks on Susie
I'm not
Davis
attacking
today.
you.
I
And
make,
let's just talk about what I've asked you.
I'm saying point of order, I believe.
Tim, you have
can we
something?
go vote? I'm recording.
Well, I'm not done with presenting the bills that I,
What's the question? I call for the vote, please.
There's no vote.
it's a point of order. This is a discussion to talk about the bills that we have, and I'm on the subject of how extremely high the legal bills are. So I'm gonna move on to the Aspen next, okay? Once I'm done, okay, all right? And I am elected to do that, and here's my certificate. To take some time, this is a business meeting, okay? And no personal attacks on Cynthia Davis today, okay? We actually have an audience.
rest of your responsibilities as a
Right.
board member as seriously as you
So,
do being able to read that.
Mr. Chairman, the director of the health department doesn't need to speak when we are discussing these bills.
Ms.
Let me
Davis,
ask her a
are
question.
you-
Is
are
that
you-
correct?
Are you gonna proceed here or what?
I am.
What's
I just
going
asked
on?
you a question. Could you please run the meeting so that she's not interrupting while,
You're
then we'll be done with
You're
this.
attacking me and saying I'm not running the meeting properly? I wish you wouldn't attack me
I
like that,
wish
man.
we could have a point of order and keep,
I wish you would.
she has the
do-
time to make her comments. and
Either make your point or I'm gonna call the question on the,
I am making my point. If
No.
other people just be quiet, I can finish. Thank you, thank you, thank you. So what I'm saying is between October and now, we've spent way too much on legal fees, and I want to see those come down.
Move on,
Regardless
Ms.
of
Davis.
what-
Move on, Ms. Davis.
All the excuses are. And we were spending $5,400 this month on Aspen issues.
Yes.
Okay, so that's, the public is
What's the problem?
asking
What's
me
the-
tons
is
of
there a
questions
problem?
about this, and I want to be sure it's on record that that's what we're spending for Aspen just this month. Okay?
And why are you bringing that up?
Because there's always people asking me about Aspen.
Okay, so are you against taking
Is-
action that's being paid for with a grant to try to prevent
So
Ms. Davis, I'm so sorry.
finish
to try
your
to-
statement.
to try-
One person talking at a time.
To
Board
try to
members can
prevent-
recess.
drug use, to try to prevent substance abuse, to try to prevent mental illness, to try to prevent suicide. You don't want to do that.
So you can't say I don't want to do that because you don't know what I
What do you
want to
say?
do or what I don't want to do.
You don't have any plan.
What we're doing right now, the discussion is, shall we approve these bills? And the subject is that, and I'm saying the legal bills were high, and now I'm saying that the Aspen program is costing us again, let me see here,
So what's your
this
point?
month.
What is your point, ma'am? If you don't have a point, I'm gonna call a question.
So the Aspen bills this month are, hang on.
Yes, my program.
You can't call it in the middle of me.
He can call whatever he wants.
Making references to what we're spending. So, Aspen this month, $17,193, an additional $3,960. And another additional $630 for Aspen.
What's the
Now,
point?
The comment has been made, and I want to clarify this on record, that all this stuff is paid for by grant funds. No, it's not. Those grant funds are coming into our general revenue fund, and they're not specified to only be spent on Aspen. I've been
You're-
doing my homework.
You're
okay?
absolutely wrong, ma'am.
No,
You're
well,
absolutely
let's
wrong.
prove me wrong.
You're-
Produce the documents that are being
You
asked.
have to prove us wrong. You have to prove us.
But
All
the
right, I'm
It
gonna,
doesn't work that way.
that are coming in to pay for this are going into the general fund, and they have not specifically been said that we have to spend them.
Ms. Davis,
on
what
gas.
do you have of that? Because we have the documents that show that the money that is coming into the general revenue, Ms. Davis, sunshine it. As
All right.
you have
okay,
access to.
all right, let's go. Call the question.
This meeting for me. to
All in
see.
favor of approving the January 2023 expenditures is total given, please say aye. Aye.
And no.
Ma'am, no, thank you. Those are approved 3-1. Approval of the January 2023 electronic payments. The actual amount on those are $471,640. and 52 cents. Can I have a motion to approve those?
Motion to approve.
Second,
Okay, any discussion on those? Hearing none, all in favor of approving the January 2023 electronic payments in the amount stated, please say aye.
I,
Those are approved. Next item is pre-approval of the March 2023 electronic payments. Estimated amount for those is $604,837.25.
Motion to approve.
And a second.
second. Oh, you second, I'm sorry.
Okay, so the motion second to approve those. Any discussion? Hearing none, all in favor of pre-approving that amount, please say aye.
I,
Okay, so those are approved. All right, the next item on the agenda is our director's report.
Okay, I have two things, or sorry, I only have one thing now to add. I am adding an Aspen update and a communication, sorry, I do have two things, and a communications update. What I'd like to do is to move up number 2 to number 1, if we can. I have Lapiana, who are our strategic plan consultants, on today to just give you all an introduction to who they are and what we're going to be doing. So Anuka or Ariel, would you like to take that?
All right, sure. Thank you. Can you all hear me okay?
Yes.
All right, terrific. And then we have just a few slides to share. Let me just make sure that we're able to do that. 1 second here. All right, here we go. All right, so hopefully you all should be. Oh, yeah, there we go. All right, so my name is Onuka Ibe, and I'm a partner with Lapiana Consulting, and I'm joined here today by my colleague Ariel Donnellan. And we appreciate this opportunity to share just a brief overview of the work we'll be doing with the health department over the next few months. Part of what we wanted to clarify up front is just, you know, what are we working towards? So what's the project goal? We had a chance to meet earlier this week with members of the staff to kick off the process. And what we're working towards is working to develop a strategic plan that allows the health department to develop a strengths-based strategy and a detailed set of action plans to allow the agency to provide positive outcomes to the community and also to be resilient as an organization, as an agency. Why is this important? By having that strategic clarity throughout the entire agency, so from the board, including all the staff, as well as the work that you all do in partnership with other organizations, that you'll be able to make sure that your decisions, your people, your funding and resources are all aligned towards those efforts that lead to the greatest impact. A clear strategy will also make sure that the agency is able not just to decide what it will do, but also to have the clarity to understand when something is either not worth doing or when an existing activity is maybe no longer adding enough value to continue to be prioritized. I'll say a little bit about our organization. So Lapiana Consulting is well suited to partner with the agency on this project. For about 25 years, we've been providing consulting services to over 1,400 government agencies, nonprofits, and foundations. And these include city, county, and state health departments, as well as nonprofits and foundations focused on healthcare research, policy, and delivery. After years of research and testing with organizational leaders, we created an approach to nonprofit strategic planning, and that's the basis of our engagement with you all. Our approach builds the capacity of organizations to develop strategic plans that adapt to their changing world instead of gathering dust on a shelf. You know, all of us have examples of plans that as soon as they're printed are irrelevant. So our process creates a plan that really is updated in real time as you learn more information. So it truly becomes something that you're using to guide your work and your decision-making on an ongoing basis. Central to that approach is a focus first on getting clear on strategy and then creating detailed plans. And so the first part of getting clear on strategy is a step that a lot of strategic planning processes skip. And that's part of why, as the situation changes, so many of those plans become obsolete. But by first getting clear on the organizational strategy, the health department will be positioned well to adapt its plans as needed as the environment changes, either internally or externally. I'm going to hand off to Ari to talk about the project phases.
Hello, everyone. Sorry, I was having some issues advancing the slides. So for this project, we've proposed 4 different phases, and we will be partnering with a project team of health department staff on the first 3. So we'll begin by getting an understanding of the current internal and external operating environment through a review of documents, discussions with project team about relevant trends and players, really focus and focus groups with the staff and the board, and interviews with others who know the health department's work well. So what we're really trying to do is understand the current context that the health department is in, just sort of what we're working towards. So then we'll bring together the staff leaders and the full board for a series of strategy development conversations. So each of these conversations will build upon the one that we've had before. And part of this process will clarify the most important questions facing the agency, and will propose an answer to it. And so this answer will then be developed and fleshed out into the strategy. So before the board approves the strategy, we will be sure to test it by speaking with staff and a representative group of health department stakeholders through additional interviews or focus groups. And so we will then take the input and the feedback from those second round of conversations, refine the strategy, and start looking ahead to priorities for successful implementation, and present a recommendation to this board for adoption. So we will document project inputs, outputs, and outcomes as a strategy roadmap that the agency can use as a living document, and to manage and update the strategy on an ongoing basis to make sure that it is current and reflective of Jefferson County's community's needs. Once a strategy is adopted by this board, we will work with the health department to decide if our assistance is needed for the implementation planning phase, or if staff have what they need to develop plans out on their own. And so I'm sure you're wondering what will be requested of the board during these different phases. And so we would love to meet with you as part of the assessment phase, and you will be central to the strategy development conversations. So we want to make sure that your voice is represented throughout the different phases, and then you'll then vote on whether to approve the project team's recommended strategy at the end of the 3rd phase. And so if there are any questions, we would be happy to answer them at this time.
The question I would have is what are the stakeholders that you talk about in your presentation? Who are the stakeholders? Do you already know, or do we need to ask Ms. Holman?
So we'll be working on identifying the stakeholders with the project team. So that was one of the conversations we began earlier this week. Part of what we've already talked about is meeting with staff as well as meeting with this board. And then in the first phase, what we're looking for is people that really know the work of the organization. So that the main goal of that stakeholder engagement, that first phase, is to get a sense of what are the strengths of the department, what are some of the trends that are in the field in which you all operate. So what are the things that we need to make sure our strategy is accounting for? Who are other organizations doing similar or adjacent work? And what are they doing well, and how might that influence the strategy, et cetera. So generally in that first phase, we're looking for people that really know the organization and its work. Once we have the proposed strategy which comes out of the second phase, when we go out and test, we'll usually there look for a broader subset of stakeholders. And so we'll likely go back to staff, but that's where we might actually talk with with residents of the community. So depending on what the proposed strategy is, we'd want to get a sense of, if the department went in this direction, how would you see this? Is this something that would meet your community's needs or your individual needs? What are questions or concerns that you have about that? We might also engage organizations with which you partner serve various communities, might talk to maybe there are other departments or agencies in the government with which you partner. A lot of that will become more clear once we have the proposed strategy, because we'll then use that strategy to figure out who could best give us insight into whether or not this is the right path or how we might need to refine this.
And if you had used a term at the beginning that I had not heard in business before, you said strength space. Could you define that, please?
Sure. One of the things that's core to our approach is making sure that whatever you're going to do, you're doing something that you're uniquely suited to do. And so a core part of the early part of our process is to get a sense of what is your unique strength or differentiating strength, or sometimes we refer to it as your competitive advantage. Part of why we do it in that way is that a lot of organizations will start a process like this and do what's referred to as a SWOT analysis, strengths, weaknesses, opportunities, threats. And a lot of organizations will look at that list of weaknesses and think, all right, we need to tackle all these weaknesses, and spend a lot of time trying to build up those weak areas instead of focusing on their strengths and maybe partnering with other organizations that can fill the gaps that organization has. So our approach is to first get clear on what is the unique value that your department brings that other health-focused organizations or agencies or companies or nonprofits or whatever it might be that they don't bring, so that you can really focus your efforts on that unique lane that you can fill. And if there are areas that you're not as strong, either just being okay with that or partnering with other groups that are stronger in those areas towards a larger impact. So a real key part of this is working from a position of strength.
Thank you.
Mr. Chairman, could I ask a question?
Sure.
Okay, so I'm Susie Davis, and I noticed there's a member of the public here today, and I'm sure they haven't heard anything about this. And just to fill them in, from what I know is that Kelly Vollmer feels like we need to have this service to come up with a strategy for our future for the health department. That things have changed since COVID, et cetera, et cetera. So I think what the public are going to want to know next is what kind of contract have we entered in with your company, and what is it costing so far, and what will it cost?
So Ms. Davis, you approved the contract at the last board meeting. You had a copy
Right,
that you
and so
read,
since
and
the
you voted on
Public
that
is
too.
here. We're asking that. Do you have that handy?
I'd also like to say, Ms. Davis, that strategic planning is part of process for accreditation, which we've been involved in now for quite a long time. So it's something it's not Ms. Vollmer's decision to do this. This is
Okay, so
something that we
the
do.
question I'm asking him is the cost of this program.
Why don't you-
$35,000 is what the contract is for.
Is that
Am I correct, Tanika? I believe. We don't have contracts with that. When you ask these
Okay,
questions
that's
ahead of time and prepare for this, then Ms. Davis,
And then
I'm
you-
answering your question. So when you ask for these things ahead of time, we can supply them. I'm more than happy to say, I think if I remember correctly, it's $30,000.
The minutes from last meeting notes say $35,000.
Okay, so
Since you approved today.
So thank you for that
So-
answer, Ms. Vollmer. And
That
then the
information
next
is
thing would
available to the
be,
public.
would there be additional costs beyond that 30,000?
35,000.
35,000.
So our contract is structured as a fixed price contract, so there would not be any additional costs without approval from this organization.
So there's plans on even more future contracts and more costs.
No,
So
it's
No, that's not what I said. I said that there would not be, we've defined a scope and there wouldn't be additional cost unless you all ask for that and authorize that.
Okay, so, for Mr. Leader Grant, for example, he's here. Maybe I could let him speak for himself, if that'd be okay. What
Ms.
is
Davis?
Let's move on.
something he would be
Do you have a
curious
question?
about? Yes, I do.
Could you?
My question is, why would we reach out and spend this kind of money instead of letting our director do this, who's well paid with a great salary, and why is she not doing this for us?
Why would you second the motion to accept the contract if you had these kind of holdbacks and thoughts on the process last month? That doesn't make sense to me. It's like you're just trying to start an argument about something and it's silly. It's a waste of the board's time.
Exactly what you're doing.
Wasting the board's time is what you're doing because you already seconded this and voted on it.
Very big staff here that,
And it's common
It's
practice.
It's normal business
Exactly.
practice to use consultants.
I'm
Can we-
just saying,
For local health departments and a lot of nonprofit organizations to contract with companies to do these things. Again, it's common practice, which you approved at the last meeting.
yeah,
And
and
which was
there's not grant funds.
I don't see a question for the
Right.
beginner here.
There are grant funds for this one, and that was brought us the last board meeting.
No,
Standards are having specifically for.
that's what you say, that's what you say.
I am so
But the
tired of you trying
actuality
to say you-
is.
Then you have to tell your constituents what the truth is, but you don't,
When
because
the
you just
grant
make
was
stuff
asked
up. We have
for,
given you, no, we
It
have given
didn't
you links to
specifically
all of the
say
meetings
it was
that were
for
presented and
that.
all of the information.
So we can
and
use it for whatever.
We're wasting the time of these good folks.
Well,
Is there anything else?
Report, absolutely, I agree with
Anything
that.
else?
I'm sorry, guys.
If there are no other questions, no other questions for them? Okay, anything else, folks?
Nope, that's it on our end.
I apologize. Thank you very much for.
All righty, great.
Thank you all.
Thanks for
All
your,
right, we'll be talking with you all soon.
thank you.
Thanks, guys, nothing personal,
How many times do we have to answer your questions, Ms. Davis?
as many as I asked,
Oh,
because that's why we're here, it's a business meeting.
so it doesn't help for us to answer your questions?
No, yep, answer them again, again, and again if you have to,
No,
Until
we're
they-
not.
clear.
Okay,
We're gonna
all
move forward.
right, let's move on.
Oh, sorry, okay. The next thing the next presentation will be a clinical services report from Melissa Parmalee.
Good luck.
Thanks. Try to pay attention. Good afternoon. How are you all today?
Eugene.
So I asked to speak to you today about the clinical services report because I did a little restructuring. This report is something you get every month. And you've seen it in your packet every month. I don't always speak to it, but there's a report every month. The difference going forward, oh, thank you, Leanne. And she has it pulled up here, is that I separated our clinical programs and sections and tied that to our foundational public health services. The contractor grant that applies to those programs and sections, and then just added a narrative highlight. So a little less detail on that end, but then we also have a dashboard that was added that was available through the implementation of QRMD. So Brian, would you mind pulling the foundations of public health services up, just so that I can speak to that? Right. So you guys have probably already seen this. This should not be new. This is Missouri's current model for how health departments should be providing the minimum set of fundamental public health services and capabilities. So you could see from our clinical services report that you have in front of you that a lot of our clinics and the services and programs tied to those clinics, those function in multiple ways through those fundamentals of public health services. So these aren't programs that were just thought up and, you know, move forward. These really do tie to what we should be doing as part of public health and what Missouri says is the focus of those public health services. So like family planning, for example, that meets the foundational public health services of maternal, child, and family health, communicable disease, and access to care. So most of these programs hit on multiple different foundations. Do you have any questions about the foundation of public health model or the restructuring of the narrative?
I like the layout.
Okay, so I'm gonna talk first just about a couple of highlights, and then I'll talk a little bit about the new dashboard that you'll see on page 2 and give you some opportunity for some feedback. A couple highlights. I wanted to point out the Title X equity funding that our clinical team sought and received for the purpose of period poverty kits. So this year, Title X had some funds that they were able to focus on equity-specific projects. And our family planning team wrote for this additional funding to be able to put together period poverty kits to supply to our clients. So that was a significant project for them to undertake to move that forward, and we're really proud that they received that additional funding. The TB program has moved back into clinical services and under general clinic, and we've been working really hard to identify a coordinator, an RN coordinator, to get our staff trained and to set up structure for those to be done under our clinical general clinic. I'm not going to read every section, but I just wanted to highlight those 2 sections and see if you have any questions about the narrative piece. Okay, so this is something a little different, a little fun, okay? When we implemented QMD in August, one of the benefits of this new electronic medical record system that we did not have before is the reporting capabilities. And this is my first go at this dashboard. So we just got access to this reports module in December and got trained. So I'd like for you guys to take a look at this, and I'm going to give you some cards so you can write down any feedback so we don't have to take time in the meeting. And Mr. Peg, if you want to send any feedback you have to Brianne, that would be great. This is my first go at trying to put this together. So some of the data you see there shows you unique patients by location, appointments by clinic location. It shows you our no-show rates, which this was a significant visual for us. We did not have that before. And it also shows you our patients by resource. So the resource is the type of clinic. So the difference between our general clinic, our mobile wellness, testing, community clinics. And I think it's a really good visual to show you the differences from month to month and the different, the number of patients, the types of visits that we're seeing, and the no-show rates. So I'm going to hand you all a card so you can play along. Yeah.
Do we know why the no-show rate was so high in October?
Yeah, so if you look at October's peaked in all areas, right? I'm really glad that you asked that question because what's happening in October? Anyone? Flu shots, yes. So we do a ton of community-based flu shots. We do that through invitation by the schools. We sometimes partner with nursing facilities, skilled nursing facilities. We sometimes go into businesses. So we're providing a ton of flu vaccines during the month of October. Sometimes we get a lot of folks who sign up, especially kids, or parents for kids, and then they don't go through the whole process. So I think that's why that no-show rate is high that month, but also the number of visits that month is so high.
Mm-hmm. Okay, thank you.
I'm going to give you a card so you can provide me some feedback. And if there's anything else under the clinical realm that you would like to see on the dashboard, if you'd like to see something by program, no promises on what I'm able to do with the system that we have. But I'd love to try to be able to show you something that is important for you to see what our clinical services are providing.
So the first dashboard there, unique patients by location, is just, I know the scale is a little bit off, but
It is, yeah.
so like for High Ridge, it looks like it's You know, unique patients, but less than 5 a month with a couple months up there is 0. That's true. That's accurate.
So this scale is very low.
Right.
It's very squished. So it would not put the exact numbers on here. We're only doing our family planning clinic out there on
Gotcha.
Wednesdays. So those numbers were really low during that time, and that's why it's at the bottom of that scale.
Thank you.
Are we defining community clinic as services provided in the community? Is
That's a
that-
great question. So when we set up QMB, we set up some different schedules to try and collect data in the best way we can. Community clinic in QMB right now is set up to be able to capture flu vaccines, to be able to capture any services where we're going outside the walls to provide those services that typically we would provide inside the building, but separate from mobile wellness.
Right, okay. Thank you.
Anything else I can answer? Right, thanks.
Thank you.
All right, next, I've asked Jackie to do an Aspen update. You want me to move the table? I've just got so much stuff.
What do you need?
You want this moved?
Yes.
Sorry.
Yes.
That's it. You got heels on, you're gonna be able.
You start with my last step of the distribution. All right, so I have, again, thank you for giving me this opportunity to come and talk. 'Cause I know there's already been a couple questions brought up today and previous questions. So I'm going to start by first addressing some that already came up regarding some of our contracts and grants and where that came from. So for example, what you might see on the purchase requisitions is the LPHDI, which is a program services contract through the Missouri Department of Health and Senior Services. And the title is the Local Public Health Disparities Initiative. And that one we had written to cover a number of different programs and projects. One of them was specifically for the ongoing development and implementation of Aspen. And so one of the deliverables is actually the contractor partner with Architect Now, which is the software firm, to enhance basic infrastructure needs, develop a resource library, implement additional behavioral health and general resource tools to reach rural and minority populations in the contractors county. So that was written and is specifically in the deliverables for that particular contract. And that was for up to $350,000.
Okay, so at this point, we've spent 621,000, so where's the other 300,000?
So that's one of them.
Allow her to finish her report.
That was the first one. That was just the one that was most recently, because each time we put in a requisition, we have a very specific contract or grants or funding stream that is connected to. So that would be the most recent one. Another one we have most recently been awarded, we were actually contacted by the Jefferson Foundation. So this one is actually a grant, and it was the 2022 Transformative Grant. This one is completely directed towards Aspen. So this helps cover staff salaries for Aspen, including myself. This helps cover attorney fees. There is some development cost for Architect Now. There's also travel expenses. So anything that we have needed pertaining to Aspen outside of some of the Architect Now larger fees, it is helping to sustain that program, including working with a consultant, because we are working on ongoing sustainability plans on how to sustain the program salaries and things like that. So that is through the foundation. That one is
And
great.
how much was that? 150?
That one was, we were awarded $338,354, but again, that covers a
a multitude of things. There was, I apologize, 20,000 allotted to attorney fees. And there was 40,000 allotted to, architect now.
Okay.
So another one, we were approached by the Department of Mental Health, who had a contract and grant with Comtree. Through Comtree had written in their contract with the state Missouri Department of Mental Health through the Administrative Agent Service Area 22 for SAMHSA Disaster Response Grant Services. They had approached us and wanted to support Aspen, knowing that we were working to include other resources in Aspen, such as helping to build out first responder components, working with healthcare workers, addressing needs that foster filter might have, as well as continuing to build our resource directory. So they wrote for 300,000 in their contract, specifically to,
What was the name of that one?
that one is through Comtree, or their contractor name is actually the Community Treatment Corporation, but it's better known as Comtree. And it's the state Missouri Department of Mental Health contract. And it is for the SAMHSA, which is SAMHSA Disaster Response Grant Services. This one was through Comtree. And it specifically states in there, again, the deliverable that we need to meet for the contract would be for Architect Now contracted services. And that is for software solutions firm to enhance infrastructure needs, foster child components, implement first responder, healthcare worker, and family advanced assessments and admin system maintenance.
And these are the kind of things I'd like a copy of. That's what I'm in the process of asking for.
That's where, and that's where I will work with Mr. Director Ballmer through that. So previously, we had been awarded a foundation grant in 2021. And that particular grant, we had allotted $50,000 for the behavioral health social service coordinated entity. It doesn't specifically say Aspen because at that point we were at the very beginning phases. So we did not have a name for it yet. That was when we were just starting to have conversations. And we had only allotted 50,000 in that grant because we were building what we thought was something very small. But as we started this journey, we realized through ongoing work with the schools, through data needs, through being approached from first responders, being approached from healthcare, that there was a huge amount of need. For example, in January and early February, we lost 13 first responders to suicide across the country. As someone who's married to a first responder, those are alarming numbers. So I think having a mental health resources and having a directory with mental health resources and having access to things like screening tools can help. So those were hopefully going to clear up some of the information regarding some of the contracts, grants that have recently been utilized to support some of the services, including attorney fees and fees with Architect Now. So that is that information. And I know that there has been other questions and things that have come up. So just to really quickly give a quick update and a brief history. So just a reminder that we came up with the concept of Aspen after we had done a large amount of community surveys and working with over 40 partners and stakeholders and did a mobilizing through action plan. And through that, it was
Stakeholders, that word.
Yes.
Who are the stakeholders?
So I don't have that information in front of me because some of them go as far back as 2018, but some of them, for example, are Comtree, Providence, Alive, what was at that time known as NCADA, now is Prevent Ed. So again, we focus on mental health, substance use, and violence ideation. Many of our schools, for example, Jefferson R7, DeSoto School District, Hillsborough School District, they were all part of these initial conversations and groups and focus groups where we looked at how we wanted to design a tool and a resource directory to meet the ongoing needs. So again, just wanted to reiterate that. So we are currently in very low implementation phases, as you can see in the Aspen report. So we have started working with a number of schools in our community
Some of the schools are not actually implemented yet. They have signed an agreement, but we are working with them because a big part of this is we want to include parent communication. So we are actually working with them to come to the school on parent nights, during nights where they have activities to reach the parent community so that they can really understand what Aspen was, how it was designed, and how they can utilize it. I know there's been some questions regarding like the opt-in, opt-out option. So not all students are enrolled in Aspen. That is not how it was designed. A student is not able to set up a profile until their parent signs an agreement. And after they sign that agreement, a parent at any time can also choose to go in and opt out of the program. So let's say I enroll my child this year, but next year I decide I don't want them to be in it. I can at any point in time go in and opt out and their profile will be locked.
So when you said they're not automatically enrolled, the information that we've been given that I'm reading is saying the opposite. It's saying that when a school agrees to come onto this Aspen program to accept it into their schools, that the data is dumped in regarding their grades, their behavior in the school.
I'm not sure where you got.
Davis, I'm not
information.
reading your phone, but that is incorrect.
Yeah.
I'd appreciate it.
And then Jackie has been asked to be able to provide answers to the questions that you provided ahead of time. So there's allow her to answer them now.
There's
I think that's a really good question because it does. I think there is a misunderstanding, and that's why I actually like the questions, because then hopefully we can clear them up, we can clarify them, and we can answer them. So I'm not sure where you got that information, but I do have the parent agreement right in front of me. And so some of the pieces in the parent agreement, it does state that the child's records will be kept confidential and they will only be accessed by or disclosed when necessary to provide services or comply with law. So what that means is, for example, if we are subpoenaed or a school is subpoenaed, it does not mean that everybody has access to children's information, and children are system. I can assure you, we have developed it. We work very closely with with Architect now, so there are no children being automatically enrolled.
So what?
Jackie, all these things were set up with input from the schools too. Is that
Correct. We have had input from the schools, input from school attorneys,
So
input from our attorneys.
things that they asked for or recommended were taken into account.
Yes, this all came about from, in our focus groups, we had school social workers, we had school counselors, we had school administrators, we had parents, we had students in different focus groups. So it was all information based on what their needs were and what their concerns were and how we could develop it in that way.
I'm looking at this page and it was published on 11/30/22. And it says, what is a student information system, SIS? Why do schools need student information, SIS? Why is Aspen the best student information system for your school? That's what I'm looking at. Now, this is what it says.
Where did you get that from? What site?
I'm not sure what an SIS is.
It's a student information system. It's housed within the school districts themselves. It's not related to public.
Yeah,
That
has
nothing to do
we
with
did
us.
not develop a student information system.
That's what Aspen is. It's an
No, it
SIS.
is not.
Aspen is a virtual platform that has a couple of different layers. Part of it is a resource directory.
Mhm.
Part of it, a student, after having the parent sign the agreement, a student that is between 5th and 12th grade can then go in and complete and set up a profile and have the opportunity to complete a screening. And all that does is look at if there is a mental health need, if there's a substance use need, or if there's possible violence ideation need.
What's
That
this
is the
talking about
only
then?
information.
You're looking at the wrong
That-
product, Susie.
Yeah, it's not my.
That's not, that's a completely wrong company and product. Wrong company, wrong product.
That's not us.
That was
Yeah.
found, somebody Googled that and pulled up the wrong side.
Find where it came from to understand exactly what that is.
Can I take a copy of that printout? Architect Now, did it, your company that we hired, Architect Now. Case study, Aspen Behavioral Health Platform, Jefferson County Health Network, 11/30/22, put this out. Yeah, I'll show you.
Can
Here, can I borrow it for just a second? I'll take a look at it and then maybe I can
Yeah.
address some questions after he's finished. Thanks.
Yeah, David, can I say something? If you get questions from people, if you feel comfortable and being able to give them correct information, that's part of your job as a board member.
It's made by a company called Foley.
If you don't know,
Is there-
if you don't know the correct information, you can refer them to Jackie, to anybody that would have that. Or you can ask them and pass that along. I don't know why all these misunderstandings are happening. And the information's there. People can access it in numerous different ways and can get correct answers. And
Well, this is something that's online that anybody that puts that information into their
And,
search engine, they're coming up with this.
I had not seen this.
It's put out by a company that we hired.
I totally got this. Do you want me to step in here and give it?
As long, it's up to, I guess, the director of the board.
Yeah, are you guys okay with
Yeah.
that? So I found what you're saying. So these are two different printouts that you have. This is one from Architect Now. This one is from a different company. This has nothing to do with Architect Now. So the one from the one from Architect Now is a blog that they talked about their partnership with us. So they were highlighting the fact that we worked on this program together and the importance that it has in the community. The separate piece that you just pulled out, the one from follettlearning.com. So that's this one. It's separate. It has nothing to do with the one that has the Architect Now logo on it.
Yeah.
So this is a separate company who
Right.
also happens to have a program called Aspen. Theirs is called Follett Aspen, which you are correct, is a student information system. That is not what this is. That is not what we have. It is not what Architect Now built. So this is something that a separate company created that just happens to have the word Aspen in it. It is actually trademarked as Follett Aspen Student Information System designed to grow with your district. So this is a tool that any district across the country could implement. This is not what we did. So these are two separate pieces. So when you Googled Aspen, this came up, which means I have one SEO optimization so that we pop up first. But these are completely separate things. I think maybe when you printed them or grabbed them, they got out of order because this says page 1 of 7 and these say page 1 of 2. So these are not related to this one at all. Okay.
Okay, thank you for clarifying that.
You are welcome.
So no,
People to hear you.
thank you for bringing that to our attention, because again, that's how misinformation can get spread. I had not found that yet myself.
You can sit here. I'm sorry, I'm also out there.
Real quick, I did want to highlight again in the agreement that it does state that authorized officials such as counselors, social workers, staff, parents, and guardians may access particular things. And again, that is part of the school. Jefferson County Health Department may only have access to de-identified data. So
Okay.
that de-identified is exactly like what you guys see in a report, where I give you some very broad numbers on we've had so many screenings completed, or we've had so many at moderate or high risk. Our de-identified data is so low that I cannot even tell you like how many were male or female, what their ages were, things like that. It is de-identified, it is not identifiable data. Law enforcement officials, regulators, and other agencies and third parties only if required to comply with any legal regulatory obligations. So they do not just have access to our information, they would have to be given information if we are legally obliged.
If something occurs,
If something occurs, if we have the subpoena, something like that. It has not happened yet. So I hope that answered that
okay,
question.
so to clear this up,
Mhm.
so I can categorize it
That's
up
okay.
here. Is there a QR code that this child can scan to get onto the system?
There is a QR code for them to scan to make a referral. So each school does have an option already in place. Typically, if they want to make a referral to refer a friend, it does not give them access to just general information. All that the QR code does is allow them to go in and say, my friend has a need, and that then goes directly to the counselor. That is the only QR code that they have access to at this time. There is an additional QR code
that is on business cards that we have that are given out to the public, for example, in our wellness statement. In our clinical offices from the desk, and that is just to our resource directory. That is simply, like if you were Googling that you needed housing, we basically just took the need to Google out. That way you can go in, access the resource directory, find if you need housing, if you need transportation, if you need additional healthcare. And that is through a QR code.
It just seems so expensive to just provide information to people that might need it. You know, I mean, it's not, it is paying for their counseling. It's not paying for them to have their bills paid or anything because
It is expensive to build,
it just is, I mean, we had this before, they needed help, they called somebody and the person gave them a little printout that had all these resources, and now we're doing the same thing.
so
Online.
what we found through, again, a lot of research, surveys, focus groups, a lot of gathering of information, and this was years of work on this. What we found is that sometimes handing people a big bunch of information can be overwhelming, especially if they are in mental health crisis, especially if they are dealing. So a lot of individuals wanted a way to access resources in a way that would help filter those resources, help identify. It was readily updated. Through grant funding, we now have a program assistant that is able to go in on a weekly basis and update these resources. We can put wait list time in them. We can put information. Handing someone a stack of numbers that we don't know if it's been updated for 2 years is not effective.
I know, I get it. But what I just can't get the concept of spending this kind of money for resources, you know, where people can, these kids are better at Googling than I am. I mean, they know how to, they need to find something. They all have smartphones.
Google's not always vetted.
Yeah.
So that's where, and again, this isn't just the resource directory, that's one component. That's where having the screening tools for students, because we don't want kids to fall through the cracks. What we found is a lot of the kids that have completed suicide throughout the country, sometimes they were not the children that had walked down to the counselor's office. They were not the children that have been identified at home. So having access to referral or a self-screening tool, if their parents have signed the waiver, an agreement that they can now hopefully not fall through the cracks. And data shows us, it continues to show us, a report that just came out on February 13th showed us that there is continuing rising needs in mental health throughout the country. If you look at our 2020 data from our ME report, we had medical examiner, I'm sorry. We had 3 deaths by suicide in 2020 that were under the age of 15. One of them was under the age of 12. I have a 14-year-old and I have an 11-year-old. And that was in Jefferson County. I'm sorry, I'm emotional about that one. The data is showing us that we need this. The systems that we have, they aren't broken, but they can be better. And that's what the focus groups and that's what the schools and that's what things.
I get that. I know everybody has good
it's
intentions, okay?
Yes.
But I'm practical. I'm like, there's a building for sale that's an old firehouse in Antonia, I think it is,
Mhm.
for 250,000. I'm saying, take this kind of money, put it towards something like that, start off center where these people that are on the street that have mental illnesses can come in and be helped
By whom?
by that, by us.
Those people
The health
cost
department,
money.
we're spending $600,000 for this
Ms.
computer
Davis,
program.
forgive me, but
I'm being practical.
this is what, this is what,
Everybody's, oh, we need to help these
this is
people,
what it-
but
this
no
is
one is
what it
doing it.
costs. This is what it costs to intervene in these issues. If you have a problem with how much it costs,
It's a resource and it's giving them where they can go, where they can go get help. It's not saying we'll pay for your help or whatever.
Real quick, I just want to explain, that's what you're explaining or what you're throwing out here at this point in time is the very difference between public health and healthcare. Public health is about prevention. It is about finding things upstream, solutions upstream, what is causing the problem and addressing that problem. And healthcare deals with people downstream.
Without being interrupted. They have no
So
place
Ms.
to
Davis,
take
may I
a
finish
shower.
the sentence?
They have no
Chair,
place to
do I have the floor or do I?
That is the problem. It's causing me to be depressed, want to
Ms.
deal with
Davis,
stuff.
if you will not allow people to
I'm
explain
just saying,
things,
this is
answer
a decision,
questions.
I'm saying.
to
things can be done.
You're
with
being
our
very
resources.
argumentative. That's correct. That's what we're doing.
This is all good and great, but I mean, it's pie in the sky compared to what we could do if we really
It's
did.
not pie in the sky. This is reality. This is a system. I'm sorry, Jackie. I am passionate about public health. I love what my staff have done. I am freaking amazingly proud of Jackie and of Brianne and of Melissa, who is just in here. My staff worked their asses off to make the best programs out of the least amount of money and resources and things that they can possibly do, because we're public health and we don't get a lot of money. So we do great things with little amounts of money, and we do it against great barriers, including a person who's waving a certificate to me over here on the other side of the table, pardon me, sorry, about how you are elected to help the people. Public health, as I was explaining, is about prevention. Prevention is upstream. You figure, no, if you want to find out,
It's a good grandstand, Kelly Wilmer, but we.
No, I am not talking to them.
There's a discussion here.
I'm gonna make a motion right now. I want to adjourn this meeting. I make a motion. It's on the table. Find out on the second, but
Let's-
we're not to control ourselves. We
Let's
civil
move
in
on.
this place across the board.
We can continue on with. the
Excuse me. Please. We can't be civil in here and control ourselves, control our passions. We need to get out of here. And that goes for everybody in the room.
Okay, so let's move on here. What else do you have, Jackie?
That was it, other than I did,
I know, well, it didn't get a second. So
Second.
okay.
we have been working on a frequently asked questions. So very quickly, I apologize, I'm continuing. We, all parents, in the schools that are in the process of implementing Aspen, when they reach out to a parent for their child to be part of the program, they do have a letter that details the program and a frequently asked questions document. Due to recent questions, again, it is great when I get questions because it just tells me that there's more clarification that's needed. So this past week, I've been working with the development team to update our frequently asked questions. You do see a draft on it because before we put this information back out to parents and make it available on the website, I do want to also make sure it is reviewed by our executive director and by our attorney. So, but I am going to give you guys each a copy
I
of
would
these.
love that.
Yeah.
That's
That
what-
way, do not distribute them until since they are drafts, until we have legal approval. It is a draft, and that's why I'm not posting it on the website yet, because I do.
So, Jackie, I have a question. You may
Yes.
probably swallow.
It is okay.
So I apologize for that. I have a question about, and I think you discussed a little bit, a question to me about the signed up or in sheet. Is there some document that they sign as a, because somebody told me that there was confusion on this document.
I think there has been, and so I will real quickly go back to that. So-
As long as you know about it and you're gonna address it, then I'm fine with that.
Yep, there is a parent agreement, and we just discussed that. I think there was just some confusion on that. And just so you know, there are terms and conditions because they're not just students. We developed a healthcare worker portal and a first responder portal, as well as we work with Jefferson College. So there are adults that access different components of it. Each component looks a little bit different depending on what their needs are and what it is. But the agreement for parents does state pretty
So
clearly.
you guys were already
Yes.
aware that there was some issue. Okay,
Yes.
thank you. That's all I need. Thank
All
you.
right, no problem.
Jackie,
Yes.
there's a website specifically for Aspen, correct?
Correct, yes. And
And
that's what we are in the process of addressing some of the questions that have been brought forward to make that information more easily accessible on the
And
website.
that's separate from the health department website because it's just a bid.
And yes, so what you see on the website, but the framework and everything on the back end needed a separate entity. So yes, the Jefferson County Health
Okay.
Network.
Can you
provide
Yeah.
It's jchnetwork.org.
JCH,
For
Network?
Jefferson County Health Network, so it's jchnetwork.org.
okay, so if anybody has questions or wants information about Aspen, it's on there.
Yes, and you can actually, it's on your FAQ sheet as well. So it says, please visit HTTPS, and then I forget the two dots in the // jchnetwork.org /about-Aspen. So that information is on there. And again, we are continuing to update it. There is also an aspen@jeffcohealth.org email address. I'm happy to receive any questions. So I can update and hopefully make the website so it is
Can you repeat that?
aspen@jeffcohealth.org.
And that goes to you.
It goes to me and the program support specialist that works specifically with Aspen.
So I have 7 pages from Architect Now. Is that us?
So that is a story from Architect Now, talking about the Aspen program that
I'm gonna
they
go
built.
over this again, and, you know, in my time, and then get back with you about it.
But thank you for bringing the other one. I didn't realize there was another Aspen name floating around out there, so that is good information to have. Thank you. Thank you, Director.
Thanks.
And the next, I'd like to have Brian Sweeney, who is of our communications, to give a report and updates regarding updates regarding some community.
All right, so I'll be quick because I know you guys wanna.
Just so everyone's aware, we all agreed that if information came that should be shared with the board, that we would provide that at the board meetings. And so that's what we're doing today.
Yeah, so I'll just go through it. Like I said, I'll go fairly quickly. I know that I'm the last one on the agenda. I think this is super fun. So you have the original communications and marketing board report that you get every week or every month in the board packet. That's not actually what I'm here to chat about, but if you do have questions about that, I'm happy to answer. We received a handful of questions through our communications@jeffcohealth.org email. They had asked that these questions be addressed. So I just went ahead and taken the time to condense all that down, read their questions, as well as the responses that we have for those. So I'm gonna throw those out to you guys really quick here. One of the things that we received was the health department board reports on the JCHD website are as follows: September, October, and November of 2022. No other reports are available to the public. I've requested several times for all past and current reports to be public and available for public transparency. So to clarify this, there's a difference between the public, the board reports and then the board minutes. All of the approved board minutes are on the website all the way up through the January 9th, 2023 meeting. I can't put new meeting minutes in there until we have the previous month's meeting or the next meeting so that you guys can approve the previous month's minutes. In regards to the program board reports, that's something that we just started recently publishing on the website. Actually, we just started doing that in September of 2022, which is why you will only see them starting in September of 2022. The December of 2022 files are the only ones that are not clickable if you go in there because the files still need to be combined and updated. I'm still working on it with internal staff to get the rest of those. But the January 2023 ones are already in there. And once this evening's meeting is completed, I'll be honest, probably not until next week, I will get those on the website as well. This is another question. JCHD website has not been updated with treasury reports. There have been specific requests about funds that JCHD receives, how the money is spent. There are grants issued to JCHD for Aspen, lead programs, COVID funds, etc. On the website, there is no documentation regarding the amounts of grants and incoming funds and how they are spent. When can we expect those to be published on the website? So the information that we have regarding agency funds that is currently on the website can be found in the annual reports, which are published every year on the website. They're also handed into the county each year for review. The treasury reports that take place here in the board meeting are not things that are placed on the website, nor have they ever been in my stuff that kind of here. And then aside from when the contracts and things like that, those are, again, outlined within our annual report as far as how much we get in grants, donations, contract funding, tax, etc. The next question was regarding, which I think we've already recognized this one, but I'll read the question because we said we would. Regarding the Aspen program, there is no update on what schools are participating, how many children are involved. The waiver states those who are authorized access to collected data are as follows: authorized officials, counselors, social workers, staff, parents, guardians, certain personnel at the health department, law enforcement officials, regulators, other agencies, third parties only required to comply with legal or regulatory obligations, crisis counselors, and professionals. To my understanding, by reading all of the waivers, all of these individuals have access to participants' data. So I won't spend too much time on this one because Jackie just gave a really great in-depth piece of that. I did want to highlight, as far as the number of schools that are participating, the publication of our annual report for 2022, which we pushed out on January 31st, 2023, 8 schools have completed agreements and intend to utilize the Aspen tool. So that number will
Is
obviously
it just for high schools or does it also include grade school?
5th through 12th. So depending on how a district is structured, that could be elementary, middle school, or high schools.
Also includes first responders and
It does also include
Healthcare
first
workers.
responders and healthcare workers as well. Thank you for that clarification.
And it's if the first responders have agreed to join.
Correct, yeah, so nothing is, like Jackie said, nothing is just, we don't, yeah, there's no way that we would be able to put everyone in there just for the heck of it, like, we have to, someone has to opt into it. So yeah, it's the same across the board, schools, first responder, healthcare. You name it. Another key question that we received, the Aspen program has a contract with a software company called Architect Now. Can you please disclose how much this agency is paid monthly for the Aspen program? So this question was a little bit different. We've addressed it a little bit before. I just wanted to make note that the work that Architect Now does is invoiced as pieces are completed. So the way that this question was phrased as far as how much are we paying monthly, there's really no answer to that because we don't have a set monthly payment. It's not like a mortgage. These are an invoice-based thing, which that's out of my realm of knowledge there. The next question. Would the JCHD board clarify how the Maximus contract tracing is being used in Jefferson County? Is there a report that can be published regarding personal names and information that is being collected? How many have been contacted? How many hangups and other data that has been collected? So Maximus was a company that we contracted with during COVID-19 to complete our contact tracing and assist with case investigations. We have not worked with this agency since February of 2021. So the person who was asking about this contract or wanting to know where we're at, we haven't had that contract since February of 2021. It was provided to us to work with the communicable disease team to assist us with contact tracing support. Per the final report that we received from Maximus, 4,955 contacts were successfully traced and 5,400 were attempted, which I'm assuming that meets the qualifications for either hangups or they didn't answer. As far as the report, there is no report of names or personal information that can be published because that is HIPAA, just like any of our other patient information. That's not something that we would provide. Would the board explain and address resolution 2201-2701? The resolution continues to state the power of the health department director to determine quarantine options and decisions. I request a reevaluation of this resolution as soon as possible. This is definitely unconstitutional to our county. So I can clarify some of this. The resolution allows the JCHD communicable disease team to continue case investigations and mitigation measures for reportable conditions under Missouri state statutes, excluding COVID, because this board voted to exclude COVID from that resolution. The implementation of this resolution simply allows JCHD to continue protecting public health from communicable disease transmission through evidence-based methods, which is exactly what the state requires. Except for again, JCHD resolution does not include COVID in that list of reportable conditions. There is nothing in this resolution that gives the agency or the director any power or authority that is not already part of the required mitigations per Missouri state statute. And the last piece here.
In that resolution, it mentions if people aren't cooperative, there can be jails and.
No, it doesn't.
No, it's not.
You made that up.
It's in there, it's in there.
No, it's not.
Oh, yeah, it is.
So bring it. I got it.
I'm saying that you need to present the information.
It reads exactly the same as the state law. It's nothing
The
different other
exception
than
code that's being excluded.
I
Yeah,
read what we're
aside
doing and I
from-
said, we don't need it because we already have that.
Aside from
Like,
COVID.
we're
it
in
is
general, we're trying.
You're doing a fine job, by the way.
Thank you.
Continue, yes.
So if there's something on there that you'd like, we can review that. The last question that we had on here that was presented to us was a little bit of a lengthy one, so hang in there with me. Regarding the COVID-19 page on the JCHD website, I have requested an update to this page. Currently, the website states how to protect yourselves and others, the following information: get vaccinated against COVID-19 and wear a mask. These are number 1 and number 2. These are very, very old suggestions. Please remove this from the website. Please remove all suggestions on the website for COVID-19 shots, especially for young children. May I please suggest that JCHD do recent research on vaccinations? There are plenty of resources that are not government funded. The VAERS website is part of the Health and Human Services Division. I have included a recent report. VAERS is the Vaccine Adverse Event Reporting System put in place in 1990. It is a voluntary reporting system that has been estimated to account for only 1% of vaccine injuries. So, as a public health department or a healthcare provider, we follow CDC and Missouri Department of Health and Senior Service guidance and recommendations for all health topics, which include communicable and chronic disease, such as COVID. Vaccination is the best prevention method available to prevent infectious disease, including COVID-19, and or prevent the severity of disease. Per CDC and Missouri Department of Health and Senior Service guidance, JCHD recommends and provides COVID vaccination for all residents who are eligible. In regards to VAERS and other vaccine safety monitoring systems are often used incorrectly, intending to spread misinformation and disinformation. VAERS and similar systems allow anyone to submit reports of vaccine injury or side effects. These claims do not have to be verified. After claims are made, government health experts perform investigations to determine whether reported injuries or side effects were due to vaccines. This is why only government reports and peer-reviewed scientific studies should be trusted. Those were the questions that we had. The responses.
Thank you.
Thank you, Fran.
Yeah, you did an excellent job. Is there any way you can provide that resolution itself to that individual that asked that question?
So the resolution, if the individual's watching, or if we know who
Is
the
it on
individual
our
is,
website?
it is on our website. It's been on our website since it was
And
passed.
what's the resolution number on that?
It is 22-01-27-01. It is right on the website on the very first page. If you go down right where it lists the name of Board of Trustees, you'll have 3 buttons: program minutes, approved board minutes, and then under it is resolution.
And that's the quarantine resolution.
Ask
That
them
is-
to compare that to the state statute.
Correct. So there's
which is
nothing
the
in
same.
that resolution. There's actually less technically, if you want to get technical, there's less in that resolution that we abide by than there is per state regulation. Because the state still has COVID and I shouldn't say we, you as a board voted that that's not in ours. So we actually have, if you really want to get technical with wording, because communications, we actually have a little bit less. So I don't know if that should make people feel better or not, but that's the facts. So thank you very much.
Thank you, Fran.
Okay, moving on to old business. First item is act upon board member request to discuss investments. I believe that came from Ms. Davis. Would you like to?
Yes, I think that, again, we're elected to do what we can do to maximize our investments that we have. And I noticed a lot of them aren't performing, not doing anything. And just for example, I went to a local bank and they can do certificates for 4%. And that's an excellent, on $100,000, that's $4,000 a year investment that we would get from our money rather than it just sitting there and we're not making. There's several of those investments I was looking at that aren't making anything. I think we should look into it.
Do you have a motion?
Motion would be to any money that we have that we can get that's not performing. I moved to look into putting it into certificates, 1-year certificates at 4% at a local bank. Was there a second?
Is there a second?
I think it's an appropriate motion because it doesn't actually give specific action to be taken.
I'd like to amend the motion and just have a financing
investment committee established consisting of 2 sitting board members to discuss the topic further.
It's pretty simple. I just think that we have money available, we can invest it for a year, 4%,
Yeah.
4,100. I mean,
Do you
don't
want
even need to
to,
talk about that. I mean,
agree to that
it's
amendment?
money we could make right now.
Do you want to agree to that amendment?
Essentially just a
We're
finance
talking
committee
about it.
to would be in a finance investment committee to discuss investments, future investments. Your motion doesn't really give a lot of detail, is what our attorney was saying, which.
Okay, I'll withdraw my motion and I'll say this to be specific. There is a local bank, and I'll even name the bank, Farmers and Merchants Bank, that for certificate of at least 15,000, which we would have, they will give you 4% interest on that amount that you put in. If it's 100,000, it's gonna be 4,000 a year.
Ms. Davis,
So my
we need a motion.
motion is that we should move our money into 1-year certificates rather, and make that kind of money rather than nothing. So why wouldn't we? Right?
Well,
I move the money to 4% interest certificate, 1-year certificates.
We not just have financial people in to tell us where the money is, what's going on, but.
okay.
Not specific, they
If
weren't
there's,
specific
there's
about
no
that.
second for your motion, do you want to make a motion?
No, it's big.
Okay,
I wouldn't want to address the finances until after we decide how we're doing the building and if what we're gonna do with reserves to address any of the building financing. So that's
and
what my
just so you
thought
know, Ms.
process is.
Davis, we did have a review prior to you coming on the board at the request of the board member at the time, who was Dr. Cherry, who asked that we do basically what you're asking us to do. And so that was done. Do we have a date on that, or when that occurred? I guess it was about
It
2
was
years.
beginning of 2020.
Yeah, about 3 years ago, I
Late
guess now.
2019, early 2020.
And the other thing you need to take into account is that as a public entity with that receives tax money from the public, there are certain investments we can and cannot do. So
Certificates, we're okay because it's out of stock.
right, well, that's one option. So,
Okay, hopefully in the future,
okay,
we can look into that.
all right. Next we have new business and a couple more requests.
We had number 2 for the lease agreement.
Oh, yeah, I'm sorry. We did make that amendment to discuss this, okay?
We had previously, the board had previously agreed and made the decision to terminate the lease at High Ridge. That was already approved. We basically just need a motion at this point in time to authorize the chairman to execute the lease termination agreement. So basically a motion to sign the agreement.
Make a motion to sign the termination of lease agreement with the High Ridge office.
Second, Tim?
Yes.
Okay. Any discussion on that?
Mr. Chairman,
Yes.
I just have people that have approached me and they say, why take away more services for the people? When even though it's not, making it as much of a difference at High Ridge as it is in other areas of the county, Arnold or here. Why take that away from them? It's a 35-minute drive from northern Jefferson County and High Ridge to get to Hillsborough or to Arnold, 25-minute drive.
Okay.
I mean,
They appreciated having that, and it's
You may.
taking more things away from the people and what they're saying is we can spend money elsewhere.
I
But
think
why
you're
are they taking
totally.
that away? That's
you're-
my
Mr.
discussion.
The board already voted to terminate the lease. This motion is simply because we've now received the actual document from the facility that they have signed off on, and we need the board to urge you to sign it on behalf of the board. The decision to terminate lease was already made and approved by the board. At that time, Ms. Davis did object and she was the dissenting vote, and that's fine, but that was already happened.
Right,
But-
so on
but if
record,
you
I'm
remember-
not in agreement.
If
So
you remember
go
at
forward.
the time, Ms.
Yeah.
Davis, there was an explanation that we are not abandoning that area or any area of the county. We're moving into having mobile services available to folks. We've got reports on all those things.
I think the per patient cost in High Ridge was about 10 times as much as Hillsborough and Arnold roughly.
You know, I,
There are a lot of good reasons to do what we did, and
since this is a discussion,
Fully responsible for the dollars. As you
Uh,
always indicate you want to.
I'm not concerned as much with dollars on that part as I am with being accessible. How about a van parked in High Ridge on that same lot by the library where
That's
some of
already
those
planned.
can go to, so they're still being serviced
So we
there.
talked about the mobile app calendar showing where all the
Perfect.
van appointments.
So if somebody comes to me, I'll have that answer for them.
yes, and since we discussed that at the time and you were aware of that, that's what you could have answered at the time. Or you could have referred them to someone who could
I
have
didn't know the
explained it.
mobile van gonna be there.
Pardon me?
I did not know that the mobile van would be there in place of that.
Well, it's not
It's
gonna
not
be there
gonna be
every
there full
day.
time. This
Well, I
this
think
was all discussed at the time.
Or at least
Decisions.
scheduled 2 or 3 days a week there, whatever. But this is just a discussion, so go ahead and move forward. That's fine.
All right, so we have a motion to allow the chair to sign the lease termination. So all in favor of that, please say aye. Aye. When opposed,
Myself,
okay. Passes 3-1. And final item under new business is act on board member request to change all approved regular meeting times. Do you have a motion for that?
yeah, so I move that we have our regular meetings at 6:30 PM on Thursdays and let the staff start later in the day to accommodate for that, so they don't have to come back for that meeting on Thursdays once a month. So the motion would be that we start our meeting at 6:30 PM once a month. And on that date, the staff would come in later that day to accommodate for that.
Second to that,
I'll give her a second so I can go to vote.
okay. Any other discussion,
Mr. Chairman,
other than the fact that we've discussed this a number of times?
Mr. Chairman?
Yeah.
According to the letter that we received from the Attorney General's office in December of 2021, I believe. They asked us to do that very thing. They said to make the meetings at a convenient time for the public, which is after work. We've had several complaints from people asking us to please have our meetings after work so they can come. And there were other things in that letter as well that they asked us to do in a larger room. So if we get more people coming, then, you know, I mean, we can accommodate another half a dozen people here or a dozen. We're fine, but if it gets to be a larger than that, then we would move to a larger spot. And that's just, you know, being transparent, doing what they're asking us to do.
We've never turned anyone away from a meeting, Ms. Davis.
I'd like to clarify that letter was an opinion letter. It wasn't a violation letter. I've heard people say that the Attorney General said
It
that
was,
department a
they
letter of
actually,
violation and it's
they
not.
actually threatened us and said that we could have fines.
We all got the letter,
I
and that's
remember
not what it
the letter.
said.
That's
Well, research shows through the health departments
Davis.
that most of them do it between like 9 AM, they do it at 12. Afternoon, they do it 1 or 2 o'clock, 3 o'clock. We are now the latest of all health departments in the area that have meetings at 4 o'clock.
We've not received any kind of direction, any kind of discipline, whatever you want to call it, from.
But the people
the Attorney
themselves have
General's
also asked for this numerous times.
Ma'am,
Please have our meeting at 6:30.
we record the meetings. They're available live, they're available online.
But they can't come and listen and participate when they have a job. That's what we're trying to
They
say.
can
Well, wait a minute, what
listen
about people
anytime
with
they want.
business?
They can ask any questions they
Well,
want.
for most of them have the day job.
Most of them.
Well, the ones that have contacted us. with
We answer
letters.
any questions people have. The refrain that we're not transparent, I mean, it's right out of the political
Well,
playbook that says if you try to repeat something often enough, people may believe it.
Mr.
And
Chairman, I.
we have open meetings, we have open meetings,
Sticking
we
to
have
the question.
meetings online, we have meetings that are available on recording, we have people who can call us, who can email us, who can ask any question that they want and answer it the same way that we've done today. And I'm not sure if you're giving people incorrect information or not.
Oh, stop
I
that.
don't know that. But
Okay,
I
here's
don't
things
know
we've done to the
how
public.
these-
We stopped their comments
We
on
have- We
YouTube.
have not
We
done.
stopped their comments on the Facebook page.
What's
We've
this have to do with
taken
meeting
all
time?
of the mail that they send to the board members
Okay,
and routed it to the director. They no longer can reach out to any of us
I do
personally.
not get the email.
This is
Please
so
don't say that.
transparent, isn't it?
Now, see, that's, you just told them out and out lie.
No.
that's absolutely.
We used to get mail all of the time. And at a certain point, Kelly Bomer said, I'm gonna take all that mail.
Miss
And I
Davis,
know
that is a lie.
Excuse me.
It's not.
Excuse me. What's the boss doing? She blind, right?
That's
Public
what,
can come to me and I've got
That's
the minutes and I've got the.
You are
I've got the-
lying to the
That's
public.
not lying.
all right, that's
It's
what
not
we
lying.
just did
You
today.
took our mail, at a certain point, they don't get it anymore.
This David,
I've had people try to send an email to.
I had a letter 3 months ago, sitting right here when I started.
Send it through you. and
that's what we just
I
did
do not
today.
get mail.
If we get questions or comments from people, we'll read
Let's
it.
call.
We are starting.
Let's call the
to.
vote, please.
Should.
We've been doing that for months, Miss Davis.
We have,
Let's call the vote.
I wish you really would stop
it's, you know,
misleading people.
you're wanting people to
Okay,
believe that, but it's not.
so you didn't get a second on that, and, oh, you did, I'm sorry, you did, I'm sorry. Okay. Your motion was to hold meetings at 6:30.
One Thursday a month and staff start later.
Okay,
And the day to accommodate. for
all
the
in favor,
increased
please
hours.
say aye. All opposed,
No.
Aye.
No.
there's no reason for us to do that. So that does not pass. Okay, do we need closed session?
Another item under new business.
Number one under new business,
I'm sorry.
number one under new business. We skipped right past.
Oh, okay, I'm sorry. So yeah, there was another item on new business to request amend the approved budget for legal expenses.
I move that we amend the budget for legal expenses to 15,000 a year.
So where do you think the money's going to come? I'm just asking, where do you think the money's gonna come from to pay bills that have already been incurred? So as you pointed out today in the meeting, we've had more than $15,000 in expenses. So if we change the budget to just allow for $15,000, that doesn't mean that we're not going to still have to pay bills. You have to pay bills that you incur, ma'am.
Going forward, 15,000 a year from this day forward.
Any second?
No.
Okay, hearing no second. That motion dies. Sorry, I skipped over that. Okay, and again, do we have?
With minutes to approve, but otherwise I don't believe.
We
that-
can't do that right now because we don't have the third.
Oh, is this the same
Yeah, it's
meeting?
from the January 26th, where Tim not around here.
Okay, then that has to be tabled.
Then it will be tabled, then we don't have those.
Okay. Okay, so can I have a motion to adjourn?
Motion to adjourn.
Any discussion on that?
Mr. Chairman,
Yes, ma'am.
there are some issues that I sent you an email about, and they're regarding harassment to me by Kelly Vollmer and by yourself and Tim Pig, and it's never been referred to a third party. And I've never gotten a resolution.
Are
Do
we,
you want to handle this in open session?
Yep,
I don't know that you do.
well, I'm just saying, I want that third party to be assigned, and I want.
That third
to sit
party
down
was
with that
assigned and the third party did investigate and that third party, there was no violation of word policy or.
Well, the third party never even contacted me, so
The
that's,
third party reviewed all the communications you complained about,
okay, well,
including the videos.
okay, that's your answer?
that's my,
As a chairman. You're not, you don't do anything about a harassment.
yes, we did.
I filed a formal harassment
And it was
complaint.
investigated per
They
policy.
never called me and never spoke to me at all.
They don't
How
have
can
to
you
now.
investigate? Okay. Thank you very much.
Okay, so the motion to adjourn. And second, all in favor of adjournment, say aye.
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 All right.
Okay, we're adjourned.